Last but not least for this week, Chapter 24, Anti-Anginal Drugs. So, angina meaning pain and pectoris meaning chest. Chest pain comes in three different types, and it is caused by a lack of blood flow to the heart muscle, which the heart muscle is also innervated, and thus a lack of blood flow leads to signals to the brain, which causes chest pain. So three types of angina. We have exertional, which is caused by exercise, overexertion, or stress. This is your guy who's out shoveling in the winter, first time he's done anything really demanding in a long time, and all of a sudden he has chest pain. He has increased the demands on his heart, and thus it's becoming evident that his heart isn't getting enough oxygen. So these are usually predictable, and it's usually due to an increased demand by the heart, insufficient coronary blood flow due to those atherosclerotic plaques. So the second type of angina is referred to as Prinzmetal's angina, or variant, meaning unpredictable. It's caused by a vasospasm of one or more of the coronary arteries, and it can occur at any time, even during sleep. Most commonly, what I know this to be caused by is cocaine use. Cocaine causes Prinzmetal's angina, and of course, if it is predictable, if you take away the cocaine, you take away the problem. So last but not least, and the most worrisome, unstable angina is a serious condition that usually occurs with advanced coronary artery disease. It is usually in coronary arteries that are almost completely blocked. Oh, my puppy's awake now. And in this situation, there is the risk that blood platelets will become activated and initiate formation of a blood clot that can completely block the artery and can cause a myocardial infarction. So, nitrates to treat angina. The main effect is vasodilation. It reduces cardiac work and reduces oxygen consumption, thereby the less chest pain because the heart isn't having to work as hard and doesn't need as much oxygen. Drugs used to treat angina, or nitrates used to treat angina, include nitroglycerin, isosorbide dinitrate, and isosorbide mononitrate. Adverse effects while taking these medications include flushing, headache, weakness, and fainting. They drop the blood pressure really quickly and really effectively, so that's hence the side effects. So, they're usually administered during attacks of angina to relieve the intense pain, and they can also be administered every day prophylactically to prevent attacks of angina. It comes in many different forms. Nitroglycerin can be a sublingual tablet under the tongue, an under-the-tongue spray, an ointment, or a patch. It can also be an IV infusion. The isosorbide dinitrate and mononitrate come in caplets or tablets. So, moving on to slide 6. This covers all of the different types of nitrates that there are, as well as their doses and their durations. As you can see, the little sublingual tablets are really quick. They don't last too long. The patches last a lot longer. And the dinitrate and mononitrate tablets last anywhere from 8 to 12 hours or 6 hours, depending on the formulation. So, moving on from that slide, made it super enlarged. Sorry, got flipped around here. So next treatment, beta-adrenergic blocking drugs, or beta blockers. We've talked about these a little before. The ability of these drugs is to decrease the heart rate and force of contraction. These changes decrease cardiac work and therefore oxygen consumption, which relieves myocardial ischemia and pain, or prevents it in this case, because these drugs are taken preventatively. Beta blockers are indicated for the long-term or chronic management of chest pain. Patients taking beta blockers usually have less frequent anginal attacks or delayed onset of pain during physical exertion, meaning they can shovel snow for a little longer before it starts to bother them. This is another way of saying that they have increased work capacity or exercise tolerance. Adverse effects include drowsiness, stomach or GI disturbances, nausea and diarrhea, as well as hypotension. On slide 8, little picture, little graph, table of our beta blocker drugs that we use for chest pain: nadolol, propranolol, atenolol, and metoprolol. And some of these drugs might seem to be, you've heard them before, they're repetitive, they're used in multiple forms of heart disease. So you might hear me say the same thing over and over again, especially decreased oxygen consumption, decreased cardiac work. This is just to really knock it home that this is what these drugs do, this is how they act. So Sorry if you get tired of me saying the same thing, but it's to get the idea that this is exactly how they work. They don't work differently one way in one disease than they do in another. So calcium channel blockers. At doses used in chest pain, the calcium channel blockers relax arterial smooth muscle and have little effect on veins. The primary effect is arteriolar vasodilation and reduction of blood pressure. This reduces afterload and oxygen consumption. The cardiac actions of verapamil and diltiazem also reduce cardiac work and can contribute to the antianginal effect. The remaining calcium channel blockers are arterial dilators with very little direct action on the heart. So keep in mind, verapamil and diltiazem act on the heart, whereas the other ones act peripherally on the veins and the arteries down below the heart. Nifedipine, the other ones include nifedipine, nicardipine, amlodipine, and felodipine. You can see they all end in IPINE. That should give you a hint. Hey, they're calcium channel blockers. Very easy to keep them in the nice little group that they're in. So they have very little effect on heart rate and myocardial contraction, but they do vasodilate. Common adverse effects: flushing, dizziness, hypotension, and minor GI disturbances. Pretty well tolerated otherwise. Slide 10 has a picture, little table of all the calcium channel blockers. So that pretty much covers this chapter. We're going to go over preferred treatments real quick once I get the slideshow back. Preferred treatments in this lovely yellow and red chart. Exertional, meaning guy's out shoveling snow and he has chest pain, or dude decides to play pickup basketball with his friends and he's 60 years old and maybe he hasn't done this in a long time. So exertional, nitrates, beta blockers, and calcium channel blockers. Variant or Prince metal, calcium channel blockers and nitrates. Unstable, antiplatelets to prevent the clot, anticoagulants to thin out the blood, and lifestyle changes. So notice how different that last one is from the rest. This is where we want to not only treat the chest pain, but prevent a heart attack. So we take it a little more seriously and add in some drugs that we'll probably talk about, I think, in the range a little later in the class. If you guys have any questions for chapters 21 through 24, please feel free to contact me. I am working Thursday as well as Saturday, so I will be in the Albany area. And otherwise, see you for week 5.